To self-mobilize the opposite AO joint, you're going to use your middle finger. You're going to follow it along the back of your skull and then towards your ear. You're going to firmly press in until you feel a bony prominence. And then you're going to hold that firmness as you nod your chin into your finger. If you do this correctly, you should get no symptoms in the middle to lower neck, and you should primarily feel pressure in the back of the head. What we're looking at is the back of the neck with the skull, the first vertebrae, the second vertebrae, and the third vertebrae. We're mostly interested in exploring the bony anatomy of the skull as it sits on top of the first vertebrae. This is important to mobilize if stiff, especially if you have a history of headaches or if you have no pain but stiffness that could drive symptoms into the lower neck or influence nerves that would communicate with the shoulders or even hand symptoms. So in the last video, I showed you a slight rotation with a nod, but you're using your hand to come into the soft tissue behind the ear and the base of the skull, putting your middle finger on that bony prominence, and then creating the nod. If you do this correctly, you should primarily feel pressure in the back left side of the ear or the head, and no symptoms down below in the lower neck or the shoulder.